Okay. All righty. Well, here we go. Hello, everybody. Welcome to the SpeechLink podcast. Today, we're talking about the oral resting posture, the ORP, the missing piece to remediating speech and facilitating habituation, better known as carryover and generalization. Happens to be one of my favorite subjects. It looks pretty simple on the surface, but there's actually some complexity to the oral resting posture. However, there's a great deal of benefit in therapy, as I think that we'll soon discover. And before we begin, let's cover some disclosures regarding financial disclosures. In addition to receiving an honorarium for this podcast, Tricia receives revenue from the sale of her well-received books. Personally, I too receive an honorarium for this podcast, and I'm a regular seminar presenter for SpeechTherapyPD.com, and I own Speech Dynamics, Inc. Neither of us have any non-financial disclosures. Okay, so happy that you are here, everybody, for our SpeechLink podcast, sponsored, of course, by SpeechTherapyPD.com. I'm Char Boshart, your speech-language pathologist host. And just so you know, this is Tricia's second time as a guest on the SpeechLink. And she's become a friend and a colleague through the years here. So Tricia H. Rogers, MS, CCC-SLP, is an ASHA-certified speech-language pathologist with 3 decades of experience and more than 20 years of specializing in orofacial myofunctional disorders. She received her master's degree in speech pathology from the University of South Carolina, then immediately started working in a neighboring school district. She's worked with preschoolers and elementary-age children and started her own private practice in Portland, Oregon. Currently, she works directly with clients of all ages, supports fellow SLPs through mentorship and consultation, and shares her expertise through presentations. Very importantly, she's the creator and author of Miss Tongue and Friends, a playful children's book series designed to help clinicians during therapy and support parents at home by playfully teaching healthy oral functions. Welcome to the SpeechLink, Tricia.
Thank you, Char. Thank you for having me tonight. I'm so excited to be here.
Me too. It is my pleasure. I'm just so excited to be doing this with you.
Me too.
Totally fun. Thank you. Thank you.
Yeah.
Now, I do have a first question to kind of set the stage.
Yes.
Just a second here. You do have a depth and breadth, I would say, of knowledge and expertise with a variety of client ages and populations, right?
Right.
So
right.
at what point of your career did you actually realize that the oral resting posture was significant?
Oh, I love this question. I love this question coming from you. So your audience is going to hear this. It was in the late 90s. So after I moved to Portland and I started working in private practice in a clinic and also in my own private practice, I was very interested in the motor parts of speech and the sensory pieces. And so I discovered your book, The OMART.
Oh my.
Oh, yes. Yes, your second edition. So I applied that because I was like, I knew something was kind of looked a bit off with the motor. Like once I got some of the intelligibility better, but I could just still, the tongue just wasn't working right, or it wasn't clear and crisp in the speech. So I found that book, which is, your pre-swallow works, right? And I am just like, and honestly, I found my notes that I took from reading the book when I was out back up to find what year it was, right? So because I put that together, and then after that, soon after I discovered your book, I took all the training, oral facial myofunctional therapy, and it just like all came together for me in that. And I've not looked back. It has just been such an important that knowledge has been so important to me and my clients, especially in my private practice.
Okay. Good.
And
Good.
in the schools, it's perfectly helpful too. It's just
With anybody.
anybody. But I just really, it helped me be able to be successful in my private practice.
Well, good, good, good. Now you said OMAR, it's oral motor analysis and remediation techniques. And I am not going to say that I'm not going to say it more than once. But I wrote that in 1995, and when I thought I knew something, and it was a good start. But I certainly learned a lot since then, and fortunately, there has been a lot of research. I know people say, "Oh, there's no research." Yeah, there is.
Oh,
There's a lot of research out there.
there's a lot. And this is just, the start, right? And we learn and you learned and all of your work has got, and there's so much research. Thank goodness.
Yeah, there really is. There really is.
Yeah.
And I'm going to say most of it, has positive results.
Yeah.
Indicates positive results. But
Yes.
yeah.
Good.
So, well, thank you. Good.
This is the truth.
This
This
is
is absolute truth.
Okay. All right. Good. Let's just talk about what is the oral resting posture? How would you describe it for us?
Yeah.
And then also, I'd like you to describe it as you would tell a parent, because it's going to be different. And then I'd like you to describe it like if you were actually talking to, a first or second grader, let's say.
Okay. Love this.
They're going to be they're going to be similar.
But a little bit different. So, okay.
Yeah.
Oral resting
Language.
posture. Yes. And I love, because it is one thing. It's not oral resting postures. It is the oral resting posture. It's what the lips do, what the jaw does, and the tongue when we're not talking, chewing, or speaking. And so as you know, it's like the tongue.
Or swallowing.
And swallowing. Yes. And the
I know
swallowing.
you
We're
meant
not
to
doing it. You're right. Thank you. Yes. It's for the swallows to be great. It needs to be in this position, but yes, not when we're not drinking. When we're not swallowing, we're not drinking, we're not chewing, and we're not talking.
And we're not moving.
We're not moving. Best posture. So the tongue is connected and elevated and resting on the palate. Okay, and the tongue tip needs to be right behind the top front teeth, not touching it. So it's right up there. There's a little piece of tissue that you can sometimes feel is kind of like a bumpy little piece. It's called your incisive papilla. And everybody try and see if you can feel it. It's right when the tissue starts right behind.
We all know where
front
that
teeth.
is.
Yeah.
Yeah.
And then
you tell the parents that, right?
Yes,
Yeah.
we tell the parents this.
Right.
And then the teeth do not need to be, they're not together. They're about a little 2 to 3 millimeters apart. So they're not clenched and they're not wide, because the lips have to be together. So the jaw has to be resting, teeth close but not together, lips closed, and tongue in that position, and then breathe through your nose.
There you go. Okay. Yeah.
So yes, you're right. With the parents, I would describe that place, let them feel it. If they hadn't heard of the term incisive papilla, I would use that. And then I would typically explain to the parents the reason why we are working on this with your child is because the tongue needs to be positioned at rest in a very efficient place for it to move and go into the sounds, for the tongue to change shape. And I tell them all the consonants are made with the tongue making contact with the palate or the roof of the mouth. And so it needs to be close. The tongue needs to be close to that space so that the sounds will be crisper and clearer when we're practicing them.
Okay. All right. Yeah. And I agree. I would use the terminology that the tongue is up within where the teeth are.
Yes, within.
So it's not touching the palate, but it's certainly up within that dental arch.
Exactly.
That is the operating zone.
Mm-hmm.
That's where all the speech sounds are made. And so, yeah. Okay.
So it's up there and it's resting. And you don't want it to be in between the teeth. You don't want it, if structurally now, if there's a structural issue and the tongue is too wide, the palate is narrow, it might have to be, a little bit outside of that space that you're talking about, the dental arch. But typically,
Okay.
I want
Okay.
it to go up
All
there.
right. Do you ever say to the parent, um, uh, I'm just wondering where your tongue rests. Go ahead and close your eyes. Think about where your tongue is sitting. Is it on the bottom? Is it on the middle? Is it on the top? Where's your tongue resting?
Right.
And 9 times out of 10, yeah, going to
Yeah.
be in the correct place. And then
Right.
I'll usually follow up and say, yeah, Johnny's tongue is not resting there.
Right. Yes.
Yeah.
Yes.
Does
And
that help or?
it absolutely does. And
Okay.
it also helps if the parent's tongue is also not resting in that position and you're having to teach the child. Because the first thing I do with the kids, I'll ask them, I'll say, what is your tongue touching? Inside your mouth, what is your tongue touching? And so I will ask them that, and 9 times out of 10, they'll be able to tell me what, because when they look in there, like you said, feel it. And the most challenging times is when the parent's like, well, my tongue does the same thing as his. I was like, okay, all right. So, and then you definitely go into the reasons and the explanation for the parent too, at the same time. So yeah, but you're right. It's fun.
Okay.
Yeah.
Okay.
Yeah.
Yeah. Okay. All right. Good. So the lips are closed, the tongue is up, the jaw is gently relaxed. Okay. All righty. Good, good. All right. So that's kind of a description. It's in the speech zone. It's in the swallowing zone. So if it's resting down, it doesn't have to go, whoa, I'm going to go up. And because we know it's not going to, it's just going to stay there and do its stuff. So it needs to be in that elevated position to really move consistently and comfortably and into the speech production and the swallowing production and that kind of thing. Okay. All right. Good. Good. Good.
And as you call it, that operating zone.
The operating zone. Yeah. And we're not like operating, but
No,
we're not going inside anywhere. Yeah. It's
Right.
a movement zone. It's It's an operator.
Right.
Yeah. Yeah.
Movement zone.
Okay. All right. Good. Good. Let's see here. Okay. Couple of things here. Teletherapy. All right. Somebody has the book. Yeah. Okay. Teletherapy. Good. Let's see if we can't cover some of that. Okay. All right. Okay. As we move along. All right. Are there any slides through this episode? No, there are not.
No.
There's no visuals. And you know what? I try not to actually, because when it goes on like Apple Podcasts and so on, then, people don't have the visual. So, but I can say that Tricia has visuals in her books. And then also I have done a course or two on the oral resting posture for speechtherapypd.com myself. And there's always, some handouts and things that go along with it.
Yeah.
All righty. Good, good, good. All righty. Okay. I do have a quote here for you, and it is an oldie but a goldie, and it's actually from 1998. Okay. And one of the points that I want to make, I was strolling through Instagram maybe a week or two ago. It was over Christmas break. And someone was saying that, we're working on resting postures because, people, they didn't do resting postures, a long time ago. And I'm saying, yeah, they did. Because I did it long time ago. I'm an old timer. Right. And resting postures has been around a long time. And in fact, Dr. Fletcher Tarr, I'm going to divert just a little bit.
Yes.
But Dr. Fletcher Tarr it had to be 1969, 1970 was when I was in college. Well, nobody can do math, so never mind. It doesn't matter. I can state that. Nobody's going to understand how old I am. Sure. But at any rate, Dr. Tarr had written a little book on the oral resting posture. And so I learned about the oral resting posture back in like 1969, 1970.
Oh,
That's even before the IAOM was formed.
right.
Okay. And so that's when I learned about the oral resting posture.
Oh,
And I think, oh boy, this is, it was kind of interesting. And I delved in. There was, a few articles and things on it, but not much at that time. So then I went off to Western Michigan University and I was telling everybody and, talking about the oral resting posture. And everybody's going, huh? What's the oral resting posture? So even at Western Michigan University with Charles Van Riper, they had never heard of the oral resting posture. So, but anyway, I have a quote here. And then, Tricia, I'd like you to sort of bounce your ideas off of it. If you agree, if you disagree, but it's from Landis in 1998. Okay.
All right.
Helping an individual optimize their static, which is an interesting way of putting it, their static oral resting posture facilitates achievement of fluid, efficient, and economic movement patterns needed for accurate and fluent speech.
I love that quote.
Did you get it? You got it?
Yes, I got it.
Okay, static, achievement of fluid, efficient, economic movement, all of those things. Yeah. Yeah.
So
What do you think?
what makes me think is that when the tongue is resting, it's really not just at rest. It's not doing anything. And one of the things that I would hear from parents and could then explain what happens with the resting, because there's this like the muscles of the tongue are keeping themselves, they're like actually working even though they're at rest at that time. And so I would explain, so the parents would say to me, well, their tongue is too big for their mouth, or their tongue is lazy, or it's floppy, or something like that. And I would explain how having the tongue resting and having the muscle contracting, the little tiny contractions that happen, that actually helps with that little bit of toning or endurance ability with the tongue. And I said, trust me, you're going to see that after they habituate and get the tongue resting posture the tongue position that we want it to be for the rest posture, then what you're seeing is not going to be so apparent anymore because it's going to have more tone. And it's really cool to see that. So that sticks out of me with that quote. What else, what do you think sticks out for you for the other that I didn't mention?
Economic movement. Because of the sides touching the, a little bit, the edge. The edge of the hard palate.
Right.
But mostly it's touching the sides, the insides of the top back teeth.
Right.
To one degree or another. And that economic movement comes from a couple of different things, but primarily the sides of the tongue anchor to the side teeth as the front part of the tongue moves. And then as it moves to the back of the tongue elevates. Speech is vertical. The front part of the tongue moves vertically. The back part of the tongue moves vertically. And it moves in refined small manners according to Landis and according to you and me, Tricia.
Right.
Exactly. Small itty bitty movements. And you have to, because you have to fit it all in, co-articulated speech,
Right.
via the points of stabilization. So the one thing that we didn't mention regarding the positioning and the, I'm going to say, anchorage and bracing of the
I was just thinking about that.
Yeah. Tell us.
So it's what the bracing, the Gick, is that you're thinking about that study?
Dr. Jeck. Yeah. Jeck. Yeah.
And active tongues are braced, and it's that lateral, the back lateral edges and the stabilization for mobilization. Because if it's not stabilized like that, then the tongue's just going to be going like this. There's no vertical, and it's going to, those refined movements and efficiency. It plays for both of those.
Right. Exactly. You've got to have the lateral margin stabilization, which in research they call it bracing. And this has been around for a long, long time.
Right.
It's been, the palatography. They've
I
been
was just
talking
going to
about
say the
it.
telegrams, right?
Yeah, the palatine, yeah, all of that. Excuse me. All of that has been happening for decades. And there comes Dr. Jick, and he has done some amazing research. And he is saying that exactly what you said, that when the tongue is moving during connected speech, that the sides of the tongue are primarily braced against the top side teeth to one degree or another. Like for T's, there's more anchorage.
Right.
And then, or for SH, there's more movement.
right.
And so you get less anchorage and less bracing.
right.
But that bracing that positioning is acquired by generating what, Tricia?
The rest posture.
Got it.
I mean,
Got it.
that's why it's so important to speech. It's
Exactly.
It's huge. Huge. End all be all of, because, and thankfully we have written words to prove that to us and studies to prove that to us, because
Yes,
it's everything.
it is. It totally is. And, I'm sure that there are a lot of people that think, and, I did for a while, that think that, hey, I'm just gonna get a tongue depressor and I'm gonna touch the sides of the teeth and I'm gonna touch the sides of the tongue, both sides. Then I'm going to have them match. And then they're going to just figure out, the tongue is going to go there and they're going to be able to make their, T's and D's and S's and SH's and CH's and all of that. And then the back side with the K's and the G's and the all of that.
Yeah.
But you know what? If the tongue doesn't live in that operating zone, it's not going to do it. It's not going to elevate to get its bracing.
Right.
Right?
And also, absolutely. And it also makes me think too, the piece about, we haven't talked about the jaw yet. Yes. And except for the resting part, but like the ability, for that stabilization and to happen, the jaw has to be able to differentiate from the tongue as well. So so the tongue has to be able to, and the jaw has to be separate. If the tongue can't separate from the jaw, then you're going to have a problem as well with the way that the sounds work. And that's when the tongue just stays low in the mouth instead. And you're trying desperately to get it to come up just for the sounds. No, that's not going to work. It has to be bracing up there from a place to start for that.
Right. Yeah. And familiar with that elevated zone. And, I've told my kids that, hey, that tongue is going to learn to live in a whole new room. If the tongue is down, you want it up here. And I say, look at that space up in there. That's a good space to park your tongue. It's just waiting for your tongue to elevate and to get up in the top there and to sit kind of out of the way, waiting for speech to happen. And it's right in that zone.
Yes. Yes.
Yeah.
When I was explaining this to the little ones, so, in my private practice, I would have kids that would be on my caseload, and then the moms would bring the little siblings. And so I would we could tell that the siblings were also very interested in what their older siblings were doing, and also maybe had the same open mouth posture, mouth breathing as their older sibling had. And so I started trying to help the kids, the younger kids, to help the even younger children. And in my books, I did these visuals of Miss Tongue putting her head on the pillow to get that vertical or elevation, and then snuggling up, like you talked about it being a new home. It's like I talked about it kind of like being the little place where she would snuggle to rest. So yeah, all the different ways we can describe this to kids and to make it click for them is super part of therapy and motivating them.
Totally. There's something I'd like to move into now, and then I do want to come back to the therapy techniques and so on that you use with preschoolers, and then therapy techniques that you use with the older kids and so on. But I also want to fit analysis in there. Analysis and therapy methods with the preschoolers. Can we move into that for a while? And,
Sure.
you've worked with a lot of preschoolers. I've worked with many, but
Yeah.
not as many as you have probably. Because I've done a lot in the schools, elementary, junior high, et cetera. Yeah. So what's your technique or strategies? Because sometimes you have to just strategize rather than just use your technique. In generating awareness of the resting posture and the positions of the lips, tongue, and jaw with your younger children.
Yeah, it is challenging. It's, each age group has their challenges, right? Adults maybe not as challenging because their motivation is extremely different. Like they've got a lot of pain and they need to want to motivate, and they're in and out of therapy quickly if they're just trying to get new habits of what their tongue and lips and jaws are doing and nasal breathing. Um, with the little ones, it's very easy to talk about what the lips are doing. Okay, so starting with the very visual with the lips and getting their mouths to close. If they've got an open mouth posture, getting their mouth to close. And then, like one little strategy with that, they get their own little lip balm and they get to like put it on their lips and then put their lips together. So, in that way, you're working on two things. One is like the closing of the lips. And then, as you talk about the endurance, the ability to keep them closed. So, closing the lips and the competence of being able to keep them that way and endure it. So the little kids kind of like that because they, especially the little girls, they're like put on their lip balm. I kind of make it fun for the little boys too. That was one of the ones I was thinking of. And then with the preschoolers a lot or young age, a lot of them maybe are still sucking their thumb or their fingers. And so talking about that with the parents or with the kids to like explain to the parents that anything in the mouth for a long period of time keeps the tongue down and it's going to stay down there because it's not going, if the tongue's down, most of the time it's not going to just elevate and become resting on its own. So you have to, so eliminating the oral habits if there are, which there are a lot. And one of my favorite, I pulled this out because one of the favorites books is that, do you remember this oldie but goodie? It's helping the thumb sucking child. So I would have with my preschoolers, all of the parents, I would have them get this book and from the library or whatever and read it and start to kind of implement a little bit of that. So I find that that's really helpful. And then you can start moving into the part of like putting Miss Tongue on her pillow, as I talked about before. Use a lot of visual aids, which is where my books came out of from this, is using the visual aids with the kids because you have to make it fun and playful because they don't understand or like, why do I even care about this? I don't even understand. Why should I even care? And it's like, rather than nagging, keep your lips together, you have to make little fun activities for them. Even the school age kids too. Let's see, what else would I?
How about analysis? I mean, obviously we can see if lips are open or closed, if it's chronically open or if they are chronically closed or if they're actually doing both. Sometimes I'm going to say it's 50-50.
Right.
So lips are pretty easy as far as analysis. Also, though, sometimes there are like 4-year-old kids that have been lowering their jaw for a long period of time. And that generates, the lack of use of the upper lip. And so you get that sort of tension of the upper lip, the lip incompetency. So you can kind of see that and just see if they can actually get their lips together. But tongue, how do you do that with the kids? I mean, if the tongue is sitting and it's forward, their jaw is lowered, hello, okay, that's a dead giveaway.
Right.
But what if their lips are closed? I know that we cannot assume that just because lips are closed that the tongue is up.
No. Right. So between watching what their tongue is doing during an articulation assessment. So when I would assess them, watching them, even if I was doing a phonology test, a Goldman Fristow, or any of the articulation tests that you can do, videotaping and watching back or watching then to see what the tongue is doing, because you can, it if we use to when I we're taught to use our ears during evaluation as speech language pathologists, but
Yeah,
a lot of it is about using your eyes. Like, what do you see? Do you see the jaw scooting around sideways when the kiddos are talking? Do you see the tongue moving like this? And so using your eyes and videotaping. Now it used to be a big deal to try to videotape and then, record it and then play it back. And now you just have the phone and yeah, so you just like having the kids see what their tongue is doing. When they watch their own tongue on the video, they're like, I said, see, did you see that? And so I think that's a good part of analysis. Um, like, I have this little sheet that I put together, and I've talked about it with Carolyn's about what I kind of do these notations about what I see the tongue doing. If it's coming forward, if it's coming down. And then, honest goodness, even the 4-year-olds, you ask them, what is your tongue doing right now when your mouth is closed? They'll tell you, they'll say, it's on my bottom teeth, it's down in my mouth, it's against my top teeth, or they'll say, it's not touching anything. And so that thing is just kind of hanging in the middle. Just, I call it the floating tongue, where it's just like, it's not
yeah,
low, it's not where it's supposed to be, it's just kind of hanging out.
yeah, yeah.
So,
Yeah.
I mean, I
Fair.
ask that question to every 3-year-olds. And surely I will use like the visuals with them. Like, I'll have this and where the tongue is, like, show me where your tongue, close and feel. And I get them to like you said, close your eyes, tell me, because you can't see if their lips are closed. And they'll tell you, they really will be able to tell you if you just,
Yeah, if they have the cognition, yeah,
Mhm.
or they'll indicate, or
Yeah.
or if you get a model and
Yep.
maybe they can show you with their hand, yeah,
Yep.
that
And
kind of
the
thing. Yeah,
Play-Doh, doing it with
there
Play-Doh,
you go.
that is, they would
Yeah,
love that.
okay, yeah,
Like, so that's really with the preschoolers.
okay,
Mhm.
okay, good, 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 good. Yeah, and the jaw's a dead giveaway.
Oh, yeah.
Yeah, if it's I mean the position of it,
Uh-huh.
and if it's lowered, and usually if it's lowered, then usually obviously the lips are going to be apart and the tongue is probably going to be down and maybe forward just due to gravity. So yeah. So the tricky one is when the lips are closed, is the tongue up? And I'm going to say chances are that it's not. And I do know that between the age of 2 and 5, there is a great deal of development going on as far as awareness of the tongue being on top, because we are told in the pre-feeding book
Right.
that, that swallowing happens on the roof of the mouth at 2. And so, there's some elevation there, some vertical movement of the tongue.
Right.
Is it consistent? Is it consistently in resting posture by the age of 3? We don't know.
Right.
And that's kind of a concern of mine, is that we really don't know. But my guess is that there is a developmental period that happens, that it kind of accumulates over time as speech develops. And I'm going to say, if you have that 3-year-old that has an that chances are really good that that tongue is on top.
Right.
No, I don't. You have a 3-year-old with great articulation, and I would love to, to do this research on it. But, find out if that tongue is in a good resting position. I would suspect that it is.
Yeah.
I have
would
a
be like,
feeling that the low tongue resting posture kind of goes along with that articulation development, or our tick that doesn't develop.
Mm,
Not always, not always.
I
I mean,
think
sometimes
that,
it's cognition, it's a thumb, there's other stuff.
yeah.
But I'm going to say in general, what do you
Yes.
think about that?
Oh, I think that's absolutely spot on. It really it makes sense. And isn't I'm thinking about some part of like the jaw development and the separation of the tongue and the jaw in there, and when it's like, yeah, that's so it completely makes sense. And honestly, like my books, what how my Miss Tongue book came to be was I was working with a very bright 3.5-year-old, almost 4-year-old. And in the session, we were talking about the tongue and a little bit. And um when I talked about her putting her head on the pillow and just trying to rest, just starting with the tip for because he's like young, right? And because he was the tongue was tired and needed to rest. The mom was like, "This really hit it," and she kept texting me like, "I've been talking about the tongue on the pillow, and he loves that." And he's like,
I
he'll
love
come
it.
to me and he'll be like, so I was like, "Okay," just like, and I kind of drew it out for him, and I showed on me, and like I think, and he went quickly with it because he was just on the cusp of like being able to do that developmentally. So that makes a lot
Yeah.
of sense. Makes a
Yeah.
and it was a little sibling, right, of
Yeah. Yeah. Oh, I love that, and I love your books, and I'm a proponent. I mean, it's just nice visuals
mm,
for young children, and
right.
I'm gonna say even like kindergarten, first grade.
Oh, yeah. I
Definitely.
I mean, because like, yeah, I have them the sooner we can get the kiddos to be having healthy oral functions, the better it's gonna be for them. It really
Mhm.
is.
Yeah. Oh, of
So,
course. Yeah. Yeah. No, that and do you have so you have one. Um, tell me which books you have. I know you have one for the nose. You have
so
one for
yeah,
the
so
tongue.
there's I have it right here. So there's Mr. Nose learns to breathe, and that's like he has a secret
Good.
superpower that helps him breathe because he does breathing better than the mouth. It's better for so the lips ask the mouth to close, and then the lips learn to stay together. So that's just these two literally go hand in hand. And then so does then this tongue learns to rest, and this and, let me show you a visual of this is one of the pictures. So I had a colleague, she's a speech language pathologist. She was in, grad school when she was drawing these for me. But I love this little one about the lips, looking at the lips in the mirror. And then
Mhm.
in the book, the kids get to try it themselves. What are your lips doing? So, and then another one about Miss Tongue Learns to Dance. And this one is about the tongue kind of being stuck in range of motion with the tongue, but it's also great for jaw and tongue differentiation work. So kind of towards the like tongue release and tongue stuck tongues, but it also is just movement of the tongue. It has she does little dances. So that's kind of fun. The kids really like this one too.
Yeah. Yeah.
Mm,
Fun.
mm.
I love it. Good for you. Good for you. And I am going to say,
Oh,
okay,
in a children's book, um, the
you
Miss
work on a
Tongue
tongue
learns,
thrust.
yeah. So a tongue thrust is a tongue thrust swallow. I really call it that. Now, Char, what do you call the tongue thrust? It's kind of a
Yeah, I'm thinking maybe Peggy means, for a tongue thrust swallow, but typically when you have a tongue thrust swallow, it's moving on the horizontal plane and the tongue isn't elevated.
right.
So I would say that probably, I mean, if they're breathing through their mouth and they can breathe through their nose, then I would say that the nose one is important, that the tongue one is important,
Right.
just to provide a nice foundation.
Right. Yeah,
Um,
that's
for the
what I was gonna say.
function of swallowing.
Yeah, they all kinda it's interesting that you would ask this because, like, the tongue resting, where the tongue rests is where it does its job or its function. So if it's resting forward or not then you're gonna have that tongue thrust swallow. So Miss Tongue Learns to Rest would be great for that. Um, And then, but if the lips are open, like you said, want to do the lips and the nose book. So yeah, so that's, and there's another one that goes, there's an ebook that goes with Miss Tongue Learns to Rest. It's Miss Tongue's Resting Adventures. So it talks about all the activities that the kids can do while they're doing those, they can keep their tongue resting. So,
Okay.
asking
And there's a
about an
question.
ebook.
Did you see the question? Because you just mentioned, Shelley is asking, is the new ebook going to be in print as well?
Oh, thank you for asking that. It will be, because there is Mr. Nose Mr. Nose Adventures and the Lips Adventures. So when that's all together, we've thought about doing to print for that. So yes, thank you for asking that. Yeah. We did, most of the ebooks were for international customers, but that one just got started, and the others are written. I just need to have them drawn.
Okay. Okay. All right. Good. Good. Excellent. Okay. Well, and we really haven't talked about the nose and working on lip closure and all of that, but, and this will kind of transition us, especially into oral resting posture and analysis and all of that. But let's focus a little bit on the nose and the importance of the nose.
Yes.
And then therapy with your older kids and your adults.
Okay. Yeah, great. Because the analysis I think of, it's interesting because like nasal breathing is a function, and it's like it's part of the rest posture, because if you have correct rest posture, then your nose is able to be the main breathing apparatus, right?
Hopefully. Otherwise, we're in trouble.
Okay.
Right?
Otherwise, we're in trouble.
Yeah. I'm not going to do lip closure unless I know for sure that they have good nasal patency.
Absolutely. So herein is the analysis. One of the first things to do is see if the kiddos can sit with their lips closed and breathe through their nose. Try 90 seconds. Then
that's right. Time.
Right. And then try 3 minutes.
Whoa. Whoa, you're tough.
Yeah.
I would try and get him to go for 30 seconds.
Yes, that's good. I mean,
start for
go for 10
or
seconds.
even 10 seconds.
Oh, yeah.
It's hard for some kids.
Yeah. You're exactly right. And here's the thing. If they can do this, if they're mouth breathing and they can go for the 30 seconds, then this is just a habit. Most likely it's just a habit that you could help shape and change. If they can't, for after 5 to 10 seconds and they're panicky and they just can't do it, that is red flag. We need to talk to the parents, talk to however in the schools that you can do. It's like there might be something that's structurally or blockage. Could be allergies, right? Could be. Don't try this analysis when the kid comes in with a stuffy nose, because that's not going to be, that's not going to be.
Yeah, it's not going to work. Yeah, it's not going to give you any
right.
percentage.
But if they are stuffy nose all the time and they do have allergies, then you're not, if that can't change without possibly intervention, then you can work on tongue posture for the sounds, but habitual nasal can be possible.
Yeah. And, I always tried to determine kind of on my own. I mean, I don't have a scope and I don't look up noses, but, I have been kind of surprised at the number of kids that just have no clue how to blow their nose.
Oh my goodness. I used to I had to teach this.
Me too.
Yes.
I know.
I'm like, I didn't realize.
Yeah, I didn't sign up for that, but yeah. What was your method?
Oh my goodness. I had this video of these kids doing it online. It was a little video to write. And I just said, here, I literally would just send this video to the parents and have them watch it. And it was like, oh God, what was it? Like, God, I can't remember now what the first step was. It's been so long since I've done it. What was yours?
Well, if it's like a, kindergarten or older child that will sit relatively still, and then I give them a tissue and they just go and throw the tissue away and nothing happens.
Right.
Then basically, you know, I like to have a nice big mirror on the wall so that we can have two
Mm.
chairs looking.
Yes.
And then
I can do
I
that.
will, you know, side by side, and then I'll put my arm around that child. I'll have gloves on.
Yes, gloves.
Okay. And have a tissue over here. And then, I mean, we talk about this first and whatever. But with this hand, I have this going this way so they can't open because they want to try and open their jaw to blow through here,
Mhm.
blow through their mouth. And so I want to try as best as I can, you know, to keep that jaw elevated, closed, you know, that kind of, so that we are getting some exertion there, you know, going through the nose. Yeah. So, I mean, I would blow my nose in front of them and
yeah.
talk about it and, you know, all of that kind of stuff. And then when the rubber meets the road, then we would go through that process. And yeah, and it's not like, oh yeah, I know how to blow my nose now. No, no, you have to. It's a process.
It's a
It's
process.
a learning process. Um, but I mean, it's so worth it because if the kid can breathe through the nose, then you can close lips and you can get the tongue up and you can get bracing.
Yeah.
And hey, you're off and running. Otherwise, you're just sort of dead in the water.
Mhm.
Yeah.
And
Yeah.
most of my situations in the private practice too, when I was doing this was like allergy related, and you need to be
Mm.
able to blow your nose and, you know, help with that because it would help to do that before you would try to do some work in the session just to kind of get at least the
Yeah.
immediate out and then throughout the session. But
Yeah. Yeah.
yeah.
You know, and it's well, let me start with this as far as therapy for the older child and just kind of go through what I did to begin to establish some kind of awareness of air going through the nose. And what I noticed with some kids was that not always did they have this extreme nasal blockage and so on, but they were so used to breathing through their mouth.
Now, right.
And when you breathe
it.
through your mouth, you are getting a larger volume of air than you do when your lips are closed and you're breathing through your nose. There's, you know, you could, and you're getting a lot of air in at a short period of time. When you're breathing through your nose, it kind of just sort of wafts through, and you have this little, always called it a ribbon of air, little ribbon of air that goes through your nose, and it's much more relaxed. Okay. And so I think sometimes the kids are like,
Yes, because it's not relaxing for them because it's new
no,
and different.
it's
And
new and
not
different.
that big space. Exactly.
Right. They're still trying to get that volume of air that
Mhm.
they can get through their mouth. They're trying to get it through their nose. And
Mhm.
so you end up with that Bernoulli effect. Remember
Right.
that
Yes.
Bernoulli effect? Yeah. And so I would, you know, kind of try to acclimate them, close the lips, picture in your mind, even close your eyes, picture in your mind just a little ribbon of air going through your nose, and just try and put the brake
Yeah.
on that volume of
That-
air
that-
trying to get through at once so that
Right.
I would actually train nasal breathing.
That's
Yeah.
deep.
Yeah.
So-
And that's, yeah. I mean, it again, it's a learning process.
It
That's not immediate, but I'm going to say it happens pretty quickly.
Yeah.
You
And
know?
I agree. When it's possible, it does. And like using the humming as that little
Mm.
activity of humming, and
Then
you do like 3 to 5 seconds of humming and then repeat it. And like if you like I would do Twinkle Twinkle Little Star, and you have to
yeah.
yeah. And then blowing bubbles.
Blowing
Because
bubbles.
I have my straw so I can talk about this. If you have the kids blowing bubbles in a cup of water, so not blowing bubbles like the other, but blowing bubbles with the straw.
Okay.
If they keep their lips closed around the straw, blow out. You have to use your nose to
To
blow
breathe
bubbles
in.
the next time.
Are,
So
are you
when
using it to breathe in through your nose and
so
then out through the mouth?
Exactly. And so they
Okay.
get so they get used to breathing in through the nose. But if they're not keeping their lips closed around the straw, then they'll just go,
They're cheating.
exactly.
Yeah. Okay.
Yeah, no.
Okay. Got an idea. Yeah. Yeah. Okay.
And
Okay.
so that was one of the ones. And they love to blow bubbles. You can do a little bit of soap in a glass and just do that and just keep your lips
Ooh.
on the straw. And
Yeah.
then
Yeah. I could see, remember the old, stuff that we all used to do with cotton balls,
oh my gosh,
you
yeah.
know, you
And
know,
ping pong balls.
blow, even with a straw, maybe a larger one or whatever, so they'd have to blow a little more firmly, and keeping the lips wrapped around. Otherwise, if lips come off to breathe in, up, then I win.
Yes.
Yeah, yeah. That may be
And
that may be good.
the one thing as far as analysis too with the nasal breathing that's super easy. I was forgetting to talk about this. You take a little cosmetic mirror or something and you put it underneath the nose and have them blow out. And think people call them the frosties. You see,
Right.
and you can also see if it's even or not. And then
Yes.
it's like if there's one side that completely isn't showing any frosties, you're like, okay, we've got a blockage.
Exactly.
And the kids but also just to use that analysis, but also during nasal breathing, and they can see them.
Exactly. There you
And then they
go.
see yours, and then they see, your own little mirror and their mirror. And
Right.
yeah,
Right.
so
Yeah. Yeah. That's a nice visual of nasal airflow
right.
or the frosties.
Right.
Yeah, that makes
And
total sense to me.
in the Mr. Nose book, I tried to get different pictures of the nasal breathing, like talk about your little ribbons, right? There's a little ribbons, and then I think there's another one where I had more. Oh yeah, this one has it where it goes in and out. I don't know if y'all can see, but it says in and out to teach the in and out because I separate breathe in, good job, breathe out, and then in and out.
Okay.
Again.
Okay. Good, good, good. All right. So talk with
Okay.
me about therapy.
Okay. So do you want to hear about like the school age?
Yeah, let's do school age.
Okay.
Let's do elementary, junior,
Mhm.
yeah, middle school. Yeah,
So, all right.
high school.
So a lot of times with like the junior high, it's really it's easy for them to conceptualize what you're talking about. And as far as what to do with the tongue, what to do with the lips, what to do with the nose. Use very inexpensive props to like a popsicle stick to have them put between their lips. This is too wide, but between their lips to help them when they're doing a quiet activity, remember, but just by tactily feeling the lips closed and just adding more times that they would do that. The most important thing is just fitting it into their life. Like, say you've got a group of kids that you're working with in the therapy session, and we want them all, several of them, to work on tongue rest posture, tongue position, lip position, nasal breathing, whatever. While they're taking turns, everybody, when they're quiet, can have that popsicle stick between their lips, and then you're working with one child on the sound, and everyone else is resting there, doing their oral rest posture. That works great in a group.
Yeah, and you might want to consider using a twisty tie. And you can get them by the thousand, right? At Amazon
Red
for
tabs.
for just short, just a little bit of money.
That's really good.
I like the twisty tie because if lips do open, and you have a craft stick or popsicle stick or a small size tongue depressor and it falls on the floor or whatever, I'm not big on sticking it back in the
Oh
in the
gosh,
lips.
no.
Yeah, and so that twisty tie will stick on the lips.
You get
Typically,
it?
yeah, and it's thinner. It's not
Thinner.
as visible. Yeah, so that I kind of like doing that.
It's like the bread tabs.
Exactly. Well,
As
I
far
was
as the
talking
thin.
about the twisties. Yeah, the longer ones. Yeah, that you twist around. Yeah, yeah.
Mhm.
What about if you have someone that just cannot elevate their tongue up to the roof of the mouth and the alveolar ridge? What if you just can't get them to do that? What are some ways to generate that position? I kind of like to divide therapy into, let's get the position and nail that, get the position, and then we'll work on the transferring of it, the carryover piece. What about the positioning?
Okay.
What
So,
about tongue position?
all right. So you're saying they can't do it.
Correct. They can't
Correct.
get their, yeah, and they'll do, I've had a gazillion kids that go, oh, put your tongue up here. Take a look. There you go.
Yep.
And, it's up there on top, and they go, oh, okay. And they're going, uh-oh, what do I do?
Yeah. 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 Okay. So, assuming that physically it can stretch up to that point, right? We're assuming
Yes.
it physically can. Okay.
Right.
All
Okay.
right. So I like to use cues, like physical cues or cues. Some of the time I would have a tiny little piece of cake decoration or little tiny. I also use elastics that you can get, the dental elastics. You can get those for little money, right? And you hang it on the tip of the tongue and have them like try to put that there, lift it up and hold it up there. If they can't do the lifting, once you have that on there, I would put a little bit of marshmallow cream on the part of their mouth where the alveolar ridge where you would like them to go, and have them
Sticks up there? Does it stick up there?
does.
I've never used that.
I'm
I'm not saying it's not good. I'm just saying, does it stick?
It's amazing.
Oh,
It's like, 'cause
good.
it used to, like, peanut butter used to be like, but so many people are allergic to peanut butter. So,
Yes.
yeah, so
Good
I
point.
literally couldn't even have it in my room. So, marshmallow cream, it is like the stickiest stuff.
Okay.
It is so sticky.
Okay.
And I would put it up there, and have them, try to put their tongue on that. That is like one of the easiest, cheapest, most fun. Okay, so, but oftentimes, like, we need to stabilize the jaw or put something to keep the jaw so that they can lift their tongue up, because trying to do the tongue and the jaw at the same time. So I would put, again, those food grade popsicle sticks, tape them together, put them between the teeth to hold the jaw, and then just have to focus on just the tongue tip. A Cheerio. Yes, a Cheerio is great. Start with a Cheerio because it has a little hole in it, and then move to something smaller, because there's a little bit of height to that Cheerio, right? You're still losing a few millimeters of having it in that spot, and sometimes that would throw some kids off. But Cheerios, great for, like, put it on the tip. I know, right? Yeah.
Yeah.
Or
And I would say, maybe on the blade, because we want that whole tongue to go up, right? We don't
Well-
got tippy tap, or are you starting off with just
I'm
the
I'm
front tongue
still-
elevation and then you're going to elevate? Is that,
yes,
are you
because-
progressing?
because it's so difficult. Well, I was thinking of the most difficult kid, of just getting the tip up there is very hard. And then because you're having to hold something or press, or you put a little bit, like the Cheerio would be good for that, or put more of a little bit of the marshmallow cream, and then do it a little bit further back, and so they have to or just, okay, press and hold it, and then you're going to have a little
Okay.
more to blade. But I'm thinking, like, literally there is no ability to even get the tip up. Yeah. And then
Okay. Okay. All right. Good. Good. Good.
yeah.
Oh my. Okay. Yeah, I think that was our last question. What about a Cheerio?
Yeah.
Oh, I hate to say this. Where did our time go?
Oh my gosh. Oh yeah,
I
it is
know.
like 5.
I know. It's the top of the hour. I just, thank you everybody for being here. I just
Thank
appreciate you
you.
being here. Thank you so much, Tricia. Very informative, very practical. Thank you so much. And in closing, I I want to thank everybody for being here and continuing to get the word out about the Speech Link podcast. And you'll be able to access this course again through Speech Therapy PD. Because there are a lot of ideas here. If you weren't able to take notes, fast enough, you can watch it again. And also, if you desire, you can access the audio-only version on most of the popular podcast apps. And thank you so much for your supportive comments and your good reviews. And Tricia, again, I just want to thank you so much. And to all of you, I hope that you realize, I hope that you realize how appreciated and how important you all are, how important you are. Thank you for all that you do for your therapy clients. And we'll see you soon. Bye-bye.